Good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is your daily medical tidbit. Do not forget to grab a copy of my new book. It's available on Amazon and also available on Kindle. What do I want to talk about today? I want to talk about trichinosis. Trichinosis. It's a big word. As a matter of fact, trichinosis is even a longer word, which is the same thing. It's a parasitic disease, all right? And it is caused by Trichinella roundworms, all right? And it's primarily through the consumption of undercooked or raw meat, all right? From animals, obviously, that have the Trichinella larvae, all right? And most commonly, it's pork, all right? And wild game. The incidence. So you remember, you have to you can't eat undercooked pork. You have to really cook it well, and overcook it even, to because otherwise you could get this trichinosis. All right. So globally, you've had a significant decline in the incidence of trichinosis, right? And I think it's because of the improved food safety measures. But in some corners of the world, including the Caribbean, where you have no tracking and no real data of the incident, it still occurs. Okay, so again, the most common cause is trichinella, right? The human ingests the larvae through the meat. Okay, and then when you eat the meat, the larvae in the meat is released in your intestines, and then and matures into an adult worm in your intestine, right? And then that larvae migrates through your bloodstream into your muscles, right? So, like I said, pigs is the biggest offender. You couldn't get it from rats, okay, and wild boar. But for the Caribbean, it's really pork that is the offending agent here. All right. So again, it's good to know that. Right. The symptoms varies. Right. Once it gets into your intestine, abdominal pain, diarrhea, nausea, vomiting. Right. That's in the initial phase. When that worm starts to move, right? Usually 2 weeks post-infection, fever, chills, swelling of your eye, bleeding in the white of your eyes, conjunctival hemorrhage, severe muscle pain, weakness, you get headaches, right? And in really severe cases, you get inflammation of the heart, myocarditis, and also you can get inflammation of the brain, right? The meningitis, right? And you can move on quickly to death. It's rare to get to that point, but it can happen, and this is not meant to scare you, this is educational, right? So remember, the ingestion of undercooked pork or wild meat, okay? All right? You can get trichinosis. And it's important that the physician has that outlook and understanding to put that in the differential, right? So to do the appropriate lab work. And this, we're not going to get into that. That's the physician side of things. But the definitive diagnosis comes from a muscle biopsy. And in that muscle biopsy, you will see the larvae in a cyst sitting, laying in that muscle. So there's treatment. It's anti-parasitic therapy. Yesterday, I mentioned for elephantiasis, I mentioned albendazole, right? So there's albendazole, there's mebendazole. These are the first line treatment, okay? And that's what you should be on. Obviously, pain control, hydration, monitoring in in a clinic or in a hospital is important, right? But so it's rare now. It's not very common like it used to be 40, 50 years ago, but it exists, right? If you slaughtering your animals at home, make sure that you cook this, properly, right? Make sure there's standards to where you buy your meats, especially pork, right? So that in of itself is important. And remember, people might say, well, we're in the tropics, we smoke the meat. Temperature alone, the tropical climate alone and the smoking does not kill the trichinella larvae. It has to get to a certain temperature, right? 71 degrees Celsius, 160 Fahrenheit is where you have to get to the minimum you have to get to in temperature to kill the larvae. All right? Freezing can kill the trichinella, but it's not the most effective against all the species that's out there. Okay? So if you're raising pigs from farming practice, prevent your pigs from eating any raw meat scraps or around rodents, rats. Okay? And again, the community or the island, whatever it is, have to have good inspection and slaughterhouse regulations. All right? Because these things were big issues in the past. Much, much better now, especially with inspections and education. So just remember that when it comes to undercooked pork, it's trichinosis, right? It's no longer widespread public crisis anywhere, including the Caribbean, but it exists, all right? There's certain, I want to say maybe up to 10,000 a year worldwide. So it does still occur, all right? So again, cook your meat to 71 degrees Celsius, 160 degrees Fahrenheit, okay? Especially game, wild game, right? Whether it's boar, whether it's deer, whether it's wild goat, right? Whether it's manikou, right? And all pork that you buy from the supermarket or you slaughter yourself, get it to that temperature, or else there is a chance that you can get trichinosis. All right? Just wanted to put that out there in the education series. Have a great day. Peace.